Hey, it's Dr. Jonathan Rubenstein. Today I'm discussing coding for transurethral robotic-assisted water jet resection of the prostate. People may know this commercially as Aquablation, but officially it's called transurethral robotic-assisted water jet of the prostate. So what exactly is this Aquablation therapy? It's a treatment for men with obstructive BPH and is performed transurethrally, so just like other BPH procedures through the urethra to get to the prostate. It's actually robotic assisted using this specialized computer, and the prostate tissue itself is ablated using a high pressure water jet. Any associated procedures such as cystoscopy with fulguration, dilation of the urethra to get the robotic arm in are all included in this procedure when performed. So the details. Aquablation had been reported using Category III CPT code 0421T. Category 3 codes are for emerging technologies. When there's enough use, when there is enough data to support a Category 1 code to get it out of the emerging technologies category, but to a true Category 1 code, it can then achieve Category 1 code. And this did achieve that status. And the new Category 1 code starting January 1st, 2026, Aquablation will be reported using CPT code 52597. This new CPT code does include a lot of description for the procedure, such as that the procedure includes all intraoperative planning that's performed to perform the procedure, including adjustments made during the procedure, any postoperative bleeding control, like I said before, with cystoscopy and fulguration. It also includes any imaging, cystoscopy, vasectomy, urethral calibration and or dilation, internal urethrotomy if needed, or meatotomy if performed. And again, why did this get a Category 1 status? Because there was enough use, and also the details of the procedure needed to be further clarified to understand exactly what goes into the procedure as being when it is when it's reported. So here's the descriptor for CPT code 52597. Transurethral robotic-assisted water jet resection of the prostate, including intraoperative planning, ultrasound guidance, control of postoperative bleeding, and the procedure is meant to be complete. That means remove the entirety of the obstructive prostate tissue, or at least enough to complete the procedure. And it would include vasectomy, meatotomy, cystourethropy, urethral calibration and or dilation, and internal urethrotomy when performed. And that is just the same descriptor as other BPH procedures, such as a transurethral resection of the prostate. There's a parenthetical in the code book that says to not report 52597 in conjunction with 52500, 52601, 52630, and 56872. And for those who know these codes, that's great. If not, those codes include transurethral resection of the bladder neck, transurethral resection of the prostate, transurethral resection of residual prostate tissue, and transrectal ultrasound. So a clinical example, who may undergo this type of procedure. Let's say a 68-year-old man who has lower urinary tract symptoms that, despite being on medical therapy, needs something more done. Has a benign digital rectal examination, a normal PSA, 100-gram prostate on imaging, and the patient, after description of his options, chose to undergo a transurethral robotic-assisted water jet resection of the prostate. So the procedure, patient identified, consented, brought to the operating room, anesthetized, antibiotics are administered, the patient's positioned, prepped and draped, and the timeout is called. Ultrasound gel is injected into the rectum, and a transrectal ultrasound probe on a stepper is inserted. Imaging is performed of the prostate to identify critical structures, such as the prostate capsule, the bladder neck, the apex, and the prostate volume is measured. Then the robotic water ablation handpiece is inserted into the urethra under direct vision. Cystoscopy is performed to evaluate for any abnormalities that may be problematic for the procedure. Once everything's shown to be in good position, the water ablation handpiece is then secured to the robotic articulating arm and alignment is confirmed. Water jets from the handpiece are tested to verify alignment of the robotic water jet. Treatment zones are planned using real-time transrectal ultrasound. Contouring using 5 individual zonal locators through the robotic software are used. The bladder neck, the Viramonte out. Then water jet ablation of the prostate is initiated, typically at the bladder neck. The ablation zone is monitored with ultrasound imaging throughout the ablation. At the level of the bladder neck, care is taken to ensure no undermining of the bladder neck. Pump pressures are monitored and increase or decrease as necessary throughout the ablation to open the urinary channel without perforating the prostatic capsule. Suction is monitored to ensure that there's no tissue occludes the water evacuation system during ablation. After completion of the first treatment pass, ultrasound images are repeated and adjustments are made if needed. Second pass treatment is then performed, again monitoring in real time. After ablation, the robotic water jet handpiece is removed, cystoscopy is performed, and cautery is used to achieve adequate hemostasis. An Ehrlich evacuator may be used to remove any clots or tissue fragments, and then a drainage catheter is placed. The work RVUs of this procedure are 10.25 for 2026. Thank you.